Dr. Sarah Sewell from Resilience RX, and today we are going to talk about how dry needling can be beneficial for rotator cuff pain. So Lindsay here has a previous history of playing volleyball, lots of pain in the front of her shoulder, which is usually where you experience that rotator cuff pain. When you're raising your arm, usually there's a mid portion in that movement called the arc sign. When the pain's in there, that's typically when it's typical of rotator cuff pain. So the rotator cuff has 4 muscles. The one muscle, though, that usually causes the majority of the discomfort that is best addressed with dry needling is called the infraspinatus, and it does this action. So it rotates the arm away from the body. That muscle is located on the back of the shoulder blade, on the bottom part of it, so right in here. In this muscle, there's usually some trigger points or painful or tender areas that when I poke on them, kind of like right in through here, Lindsay's got a nice one, those cause pain. Sometimes that pain is reproduced in the front of the shoulder, sometimes it's not, but targeting this muscle for rotator cuff pain can be really beneficial. With dry needling here, we'll target this muscle. We'll also target the C5 segment. So C5 means it's the cervical spine and it's the 5th disc down from the top. The reason we target that segment and we pair it with this muscle is because that segment is the part of the spine that primarily supplies energy to, or it innervates for the scientific word, but it basically supplies this muscle with the inputs that it needs to function. So we will do this muscle, we'll do this, and then we'll hook them up with some E-stim. So I will grab these. We'll start with the neck. It's kind of tight in there. How's it feel on your end?
Fine.
Okay. So with that one, we actually go all the way down to bone. I made contact with the bone. The needle traveled at different speeds and with different resistances through the different tissues. That means the more resistance, the more dysfunction is occurring in the muscle. So for her, the top layers of muscles, pretty smooth, but I kind of hit a midpoint that was pretty sticky, that was hard to get the needle through, indicating more dysfunction, which is not surprising considering she's got some shoulder pain. So kind of right there is where you get most of the tenderness?
Mm-hmm.
Okay. Any out here too, or not as much?
Not as much.
Okay. What about right there too? Okay, so right in here and then right in here. So we'll go for both of those areas. Okay. So with this, there's been a couple. You might have been able to see it, but these muscles up here contracted, and then through here it contracted a little bit too. That's pretty typical. We call that a twitch response. It's basically the muscle contracting and then fully relaxing. And that's what we're looking for with dry needling. That helps a muscle that's partially shortened, fully shortened so that it can relax. And then we'll go right in through there too, right?
Mm-hmm.
Okay. And that kind of went in through here. Feel okay?
Yep.
Okay. So then what we'll do is we'll take a TENS unit. This is one of them. We will attach it or make it touch both of these points out here and here. So I'll turn the E-stim on. I'll slowly increase the intensity. Let me know when you start to feel it.
Okay.
More in the shoulder or more in the neck?
More in the shoulder.
Okay. I'm going to keep increasing it a little bit. Tell me when it feels kind of moderate, okay?
Okay. Say that's kind of moderate.
Okay. So then here, you can actually see that muscle contracting and those needles moving a little bit. This e-stim is just giving a little bit of pulse to that muscle because muscles actually run based on electrical stimulation. Like the muscle uses electricity, that's how it runs. The nerves send an electrical impulse to the muscle to turn it on. So you can kind of see it moving there. Did the intensity change at all for you?
No.
Okay. Sometimes the intensity will increase, sometimes it'll decrease, and sometimes it stays the same. Whether it, depending on what it does, it's not good or bad, it just is. Let me just go ahead and take them out. A little bit of input afterwards helps with some soreness that may occur. And there you have it. That is dry needling for rotator cuff pain.